Okay, respiratory number 6. So, asthma again is episodic, meaning you'll have periods where a patient will go, um, and even long periods without any type of asthma attack, and then either an intrinsic or extrinsic factor will affect that patient and send them into an asthma attack. So something is causing them either stress, internally or externally, causing an asthma attack to happen. And then again, we want to treat the asthma attacks with a bronchodilator, open up the lungs immediately, and then after we get them through that asthma attack, then we'll put them on medications like a steroid, corticosteroid, and to keep the attacks away from happening. And then looking at how to use a metered dose inhaler with the spacer, again, we shake the medication. Um, on the end of the spacer will be a solid lip that you push your inhaler through. And then, so you're going to insert that mouthpiece of the inhaler into the rubber seal end of the spacer, and it will literally seal around it. You're going to have the patient breathe all of the air out of their lungs. Once they get all of the air out of their lungs, then you're going to have them put the spacer up to their mouth, and they're going to hold that between their teeth, making a tight seal around the mouthpiece with their lips. Then they're going to press the metered dose inhaler down, releasing one spray of medicine into that long canister there. And then once they do that, then they're going to start to breathe in very slowly and deeply. Once they get all the medication in their body, they're going to hold their breath for 5 to 10 seconds with that medication in their lungs. So again, they're going to suck all that in slowly and then hold their breath for 5 to 10 seconds. And then once again, you're going to educate them to breathe out very slowly. Want to wait about 4 to 5 minutes between the two deep presses on the inhaler, and then they're good to go. And finally, the last thing they want to do is they want to monitor their peak flow, which will tell them if they're in the green zone, yellow zone, or red zone. If they get in the red zone, then they need to get to the emergency room so they can be treated. Yellow zone means to be very cautious because they're almost going to be in an area where they're going to have an status asthmaticus if they get to the red zone. And then, of course, know what their triggers are and avoid them, right? Avoid your triggers or stressors, same thing. And then know what allergens cause their asthma attacks and avoid those as well. Try to stay calm with stress, take a yoga class, take some stress relieving activities, take time out for yourself. All right, guys, good luck on your test. I'll be thinking of you. Hoping everybody does well. Thanks.